Hi, this is Dr. Farley, and in this video I want to go over the number one most important part of your immune system, which is your mucosal immune system. Okay, so mucosal immunity, it's a barrier, okay? And you have four barriers. You've got the gut, lung, skin, and blood-brain barrier. So that is your mucosal. That is where most of your mucosal immune system will sit. But you also have mucosal immune cells in other parts of the body as well. Also, as part of your gut would include ear, nose, and throat, adenoids, tonsils, that whole area there. So many people are asking me questions about my immune system. Hey, what about colloidal silver? What about this? What about that? Well, what you need to know is you need to tend to your mucosal immune system because this is the number one branch of your immune system. Everything else comes behind the mucosal immune system. So the mucosal immune system is also really dependent upon the microbiome and your gut microbiota. So your body has about 70 trillion self cells and about 700 trillion of these bacteria that make up your microbiome. And a healthy microbiome does many, many things. And a healthy microbiome is good in number and good in diversity. You want a diverse microbiome, and you want proper numbers of the microbiome. And for most people, they're destroying the microbiome by what they're doing on a regular basis. One more thing also, if you didn't have a vaginal birth and you were a C-section baby or your child was C-section, then right from the get-go, the microbiome is disturbed because as the baby travels through the vaginal canal, that's where they're going to pick up and inoculate the first part of their microbiome from the mom. And by the way, that mom's microbiome is based on her environment that she's been around and all the things she's done right or wrong. But there's absolutely a change right from the get-go in a vaginal birth that produces a more proper, diverse microbiome and a C-section birth that does not. So right from the get-go, you're going to throw off the mucosal immune system and the microbiome and start off life in a dysbiotic, improper microbiome state. So the microbiome synthesizes nutrients. They come from the microbiome. So as you eat foods, many times the foods give you some nutrients, but really what it does is the food goes down to the microbiome. The microbiome is basically the 10th system, as I call it. So there's 9 systems that make up you, and then there's a 10th system, which is these 700 trillion bacteria that live mainly in the gut, in the large intestine, but again, they're all throughout the body. And over a time frame, they then take in the foods that you eat or don't eat, and then produce proper nutrients for you. So most folic acid, vitamin K, most B vitamins, and micronutrients will be depleted also if you're in a dysbiotic state. The other thing that it does too is it activates most plant compounds and botanicals that you take into metabolites that then go on to produce positive benefits for our body and our brain. So a lot of things that you're taking that you heard, hey, this herb is good and these plants are good and these foods are good. Well, you have to have a good microbiome or you're not going to transform that into the proper metabolites and get the benefit of it. So again, if the microbiome, which is like a filter, is off, you're not going to get the benefits of those foods. The microbiome also is a major player in biotransformation or detox, which I hear all the time about detox. If you have a bad microbiome, of course you're going to have a toxic body and brain. So to now take certain things like a massive detox tea or a chelation therapy or these other capsules that people may use or strong herbs, this can be extremely dangerous because now you have these toxins sitting inside cells that will not come out because your normal biotransformation pathways are compromised And part of that is the proper microbiome. And if you're in a dysbiotic state and your microbiome is not good, you better not push detoxification. Also, the fourth thing is the microbiome produces metabolites and turns on receptors all throughout different cells and tissues. So, really important, and the microbiome is the beginning of your mucosal immune system, and we want to make sure that mucosal immune system has what it needs. There's also a tremendous amount of research on metabolic diseases that are driven by immunoinflammatory states, and over a time frame, they can just debilitate you. So the mom, from breastfeeding and normal delivery, will transfer a good microbiome to the baby or not. Then we have stress, disease, injury, drug, surgery, diet, age-related decline, and you start getting a bad microbiome. And over a time frame, your whole health starts to decline. What else? A lot of diseases develop from a dysbiotic microbiome, and the microbiome also can be involved with a lot of gastrointestinal symptoms, from leaky gut to SIBO to loss of oral tolerance, and then I'm at a risk of autoimmune and cancer. Can lead to headaches, dermatitis, diabetes, bloating, rhinitis, depression, anxiety, bipolar, schizophrenia, obesity, neurodegeneration, food sensitivities, fatigue, inflammation, chronic pains. One more thing about chronic pains. You must look at the brain firing down to the muscles, and you must look at sustained inflammatory responses and the microbiome, or the chronic pain is never going away. We must stop looking at the knee as an orthopedic problem only. I have many people in here that I do nothing to focus on the knee or the wrist or wherever the chronic pain is, and within 4 to 6 to 8 weeks, 85-90% decrease in these areas that have been chronic over and over and over again. So you also want to know too that your microbiome and your mucosal system is majorly involved in your metabolic rate, in fat gain, and you'll never get it under control if you don't address that. Diabetes, heart disease, many of these things are connected to your mucosal immune system and your microbiome, and the dysbiotic state that most people are in. So if you have any questions, let me know. But again, this is your first line of defense to making sure that your immune system responds properly to any virus, bacteria, antigen, allergen, whatever it may be. And if you're showing signs of chronic sustained inflammatory responses, you need to look here. So whether you're a diabetic, you're an autoimmune patient, you're schizophrenic, you have depression, anxiety, insomnia, hormonal imbalances, allergies, again, autoimmune, cancer, or any kind of chronic pain, you likely have a chronic sustained inflammatory response and a weak mucosal immune system, and you're in a dysbiotic state of your microbiome. So thanks. As always, if you have any questions, please let me know. God bless you and your family, and God bless the United States. Thank you.